Good evening, guys. Dr. Nathan Thompson here with Exemplify Health Center, your Wellness Way affiliate right here in Yorkville, Illinois. Happy Monday evening to everyone. Hope you guys are enjoying this week right before Thanksgiving. And obviously, if we're talking about Thanksgiving, we're talking about the holidays. We're talking about the next 8 weeks where most people check out when it comes to their health, when it comes to their nutrition, when it comes to managing their stress, when it comes to taking care of their bodies. And so I want to talk to you guys a little bit about this. This is the first installment of 4 different things that we're going to talk about when it comes to type 2 diabetes and your nutrition, if the meds are even working, type 2 diabetes, and actually some wonderful research when it comes to things that are great alternatives to medication while you start fixing the cause. And I'm even going to talk about type 2 diabetes, insulin resistance, and even the way that you exercise. So I'm going to be breaking this up into 4 different groups. But tonight I'm going to talk about, does your diabetes medication even work? Oh, interesting. All right. So guys, if you're watching this, make sure you say hello. And if you're watching this and you know someone who has insulin resistance, they have high A1C, guys, the last thing to take place before you're really truly considered a diabetic is the thing that your doctors are measuring all the time. And they're really measuring the fire, which is loss of blood sugar control, which should not be really into the 90s or, definitely higher than 100. So I'm going to ask this question tonight: does your diabetes med even work? Okay, so we're going to actually ask the experts about, does your diabetes med even work? And we're going to see what they in fact have to say. So guys, when it comes to diabetes, I'm going to tell you something because people ask me all the time about this nutrition plan and this nutrition plan, and I've looked at all of them. Trust me, guys, the most important thing when it comes to your nutrition really has to do with whether it's going to be inflammatory or not. And the second thing that we're always going to glance at is, does this person, what's going on with their blood sugar control, what's going on with their A1C, and what's going on with their insulin levels. In fact, if you really want to know where you're heading, is check your insulin levels, obviously. So let's ask this question tonight and over the next couple of weeks: does your diabetes med even work? Now, I know that a lot of you have asked. We just received the blood work of the individual that we have been doing the post 1, post 2, you know what I'm talking about, blood work. Can't say it or else, we're going to have a warning on this video. But we just got the new one in, and I'm going to be looking at that, and I'll be doing a live about this maybe next week once we have time. And I'm going to give you what my opinion is. I've looked at some of it, and there's some pretty interesting things that are actually taking place. So we've been following this person all the way through from literally, the first time when they came in and they were pre-diabetic, insulin resistance, low immune response, low testosterone. And this person has worked very hard with their lifestyle, and they have, except for one factor. And the one factor was putting things in the body that didn't belong. And you can see how the body tries to change and tries to adapt to those things that are actually put in. And so I'm going to go over that, how literally, the biggest change that I've seen taking place, has the immune system recovered, and then is there other changes that have taken place, particularly in the liver? And I'll go over that with you, but I guarantee I will go over it in a lot of detail, only so that no one can go back and say, I don't agree with this. And I will go over all of the blood work, not just the numbers that are necessarily positive. So let's ask this question: does your diabetes med even work? Okay. Now, I'm going to say this, is that when, we start talking about this, we have a lot of people who, they don't like the perspective that we come from. Okay. They don't like that. They don't like that maybe there is a different perspective when it comes to their traditional medical approach. Guys, one of the things that's interesting is that what if there is more than one approach? What if it is more than just taking medication and being on it for the rest of your life? What if there is something that is better? What if there is something that puts the power back in the person and is saying, you have the ability to be able to heal from this. You need to start changing your lifestyle, and that, yes, we can help you. Yes, we can support you, but ultimately it's up to you. What happened to this whole idea about personal responsibility, about taking a person and about teaching them, about the basics of health, about the basics of healing? What is wrong with doing that? Because if a doctor was willing to do that, who is willing to be able to take a person and be able to explain to them what they need to change, why they need to change it, and what they need to do to make sure that this doesn't come back, we would end literally what is about 19 to 20% of our gross domestic product, which is actually healthcare. My goodness, if we would start working on our health, we would have a lot more money to pay in, I don't know, taxes maybe. So guys, there are so many people who get offended by this, but just remember this. We exist because we think and we act differently to solve the health challenges that others can't. The only reason why I'm in practice is to offer a solution that others haven't been able to do. And the reason why we have a waiting list for the next 7 weeks in our office of people who want to come in is because the traditional way of thinking about it has absolutely failed them. You shouldn't be mad at me because your system has failed. You should maybe look at your system and say, maybe we should start to do something differently, rather than to take the messenger and to try to destroy them. A lot of people don't like to change their minds. A lot of people don't like to look at things differently. And a lot of people are so ego-driven that they can't admit that maybe the way that I looked at things wasn't the right way. And maybe the definition of insanity is doing the same things over and over and over, somehow expecting a different result, or just hoping that the patient will shut up and keep taking their medications for the rest of your life. So we think and we act differently so that we can solve the health challenges that other people can't. And diabetes is actually one of them. The reason why is when you look at the number of people in the United States with blood sugar issues, it is astronomical. About the number of people who already have full-blown diabetes, but even if you take a deeper look and you look at the people who already are developing insulin resistance, meaning their body is actually trying to protect them from the overabundance of sugar and is becoming insulin resistant, because if it took all of that sugar into the cells would actually die early. And I did a live about that, I think last week or maybe 2 weeks ago. So let's talk about this, okay? What on earth, Dr. Nate, when you are talking about insulin resistance and type 2 diabetes, what do you mean by that, okay? The first thing that happens, guys, is here in the United States, we consume way too much sugar. And in fact, I always wonder why some nutritionists are saying, that food restriction is bad. Listen, if you're eating something that is a poison to you, then you should have being an adult, you should have the maturity to say, this isn't good for me and I shouldn't have so much of it, versus this whole idea about food freedom and eat whatever you want as long as you feel good about it, because you can feel great about it, but it's going to put you in a grave early. And you know who's not going to feel good about it? Your son and your daughter or your grandkids, who are going to miss you a whole bunch. So it's time to actually just say, I am eating way too much sugar, and it's time for me to put my big boy, my big girl panties on, and maybe I should make some actual changes. So the whole idea behind insulin resistance is that there's an overabundance of sugars, and that sugar ends up in the bloodstream. The cells have to take it in, and so with the overabundance of sugar, insulin is the hormone that is actually helping to lower the blood sugar and actually shuttle it into the cell, or settle it into the cells, and then shuttle it into the fat cells. And so if you keep doing that, those insulin receptors will downregulate. They won't respond as easily, as a way to try to protect the body. And then what happens is you need more and more insulin in order to get sugar into the cell. You see insulin levels start to rise, and then finally it will get to the point where you'll see your glucose levels in your blood start to go up. So if you're having a hard time when it comes to you do a fasting blood sugar and it's still over 100, you're having a hard time regulating your blood sugar numbers, okay? Now guys, this takes time in order for this to develop, but my goodness, you're seeing teenagers who are already developing type 2 diabetes. And I bet you there's probably a lot of kids that are in 4th, 5th, and 6th grade who are already insulin resistant. And you don't have to look very far to see the number of kids who are overweight and who are obese. So what happens when this happens is that, really the doctors aren't even measuring this until you've already lost blood sugar control, but they've attested properly. They could have given you the warning signs years and years before that to say, you're headed towards this. This is the consequence of doing this. And it's time for you to start changing the way that you are eating, start changing the way that you're exercising, start handling your stress, because there's a component with all of those different things, and start to change those. You would ask your doctor, though, well, doctor, what do I need to do? And he's like, I don't know, just exercise and eat right. Well, what is eat right looking like? I don't know. You know, you have a lot of fruits and vegetables and eat a bunch of, you know, grains, enough grains, and, you know, have a little bit of meat. Like guys, that's not working anymore. With the amount of stress that people are under, with the amount of junk food that's out there, with the amount of different types of food, people have no idea what the ingredients are. It takes someone who is willing to be able to sit down and be able to explain this to you concisely and eloquently so that you can understand exactly where great nutrition needs to start, where great exercise needs to start, and how to actually start handling your stress was what we're going to be going over on December 4th. Let's talk about stress. I'll show you the mental aspect of stress and how it devastates the GI system, devastates your hormones, and I'll show you from a physiological textbook, okay? So, if you are diagnosed with type 2 diabetes, which means by the time you're diagnosed with it, you are late to the ball game, doctor is going to give you the most commonly prescribed diabetes medication, and it's called Metformin, okay? This comes from WebMD, and here's what they say about Metformin. So Metformin works by helping to restore your body's proper response to the insulin you naturally produce, and it also decreases the amount of sugar that your liver makes and that your stomach and intestines absorb, okay? Just so you guys know, liver doesn't make sugar, okay? It stores sugar, but it doesn't necessarily make sugar. It actually will take sugar, it will store it, and then once you reach that storage capacity in your liver, it will then shuttle it to your fat cells as a form of triglyceride, okay? But the thing is they say it works by helping to restore your body's proper response to the insulin you naturally produce, okay? So what they're saying is that it helps you to become more insulin sensitive. So it helps you become more insulin sensitive. And then also it tends to block some of the sugar that your intestines and your stomach absorbs. That sounds like a really good idea, Dr. Nate, that would do that. I'm going to show you that when you start doing that, how it will start to change everything else. Because if you know someone who takes metformin, long term, you will understand that the number one complaint, the number one side effect is gastrointestinal upset, diarrhea, and cramping. Okay? So, let's talk about glucophage, which is metformin. Okay? Let's talk about this. This comes from the research that they used in order to approve this medication. And I'm going to show you, because I know I did a live about the paucity of data when it comes to approving boosters for the you-know-what, and then you look at this and you're like, wow, look at the lack of data on this as well, and look at such the small sample size. So here is the study that got this medication approved for, and you can find this on the internet, and you can see it comes from the FDA that approved this medication, and it shows this study. Okay, so glucophage, otherwise known as metformin, and here's what they say. In a double-blind, placebo-controlled, multi-center U.S. clinical trial involving obese patients with type 2 diabetes whose hyperglycemia or high blood sugar was not adequately controlled with dietary management alone. Now let me tell you something, guys, is I wonder, they don't say who was in charge of the dietary management, because I guarantee you how I would handle it would be much different than how they're handling it, okay? So their baseline fasting glucose levels were approximately 240, which is extremely high. So treatment with glucophage for 29 weeks, so over half a year, resulted in significant mean net reductions in fasting and postprandial plasma glucose, which means glucose levels after eating, and their hemoglobin A1C, which is a measurement of the degradation of red blood cells, and basically because high blood sugar damages soft tissue, including the collagen and the red blood cells. So they measure the degradation. This is a 3-month average of your glucose levels. All right. So what they found was that it reduced by 59 milligrams per deciliter and 1.8% compared to the placebo group, okay? So what they found is that fasting glucose 59, they found that their postprandial after eating is 83, and then that their A1C dropped by 1.8%, okay? 1.8%. Now, you're like, wow, that's really awesome. It means just taking this medication, I can lower my fasting blood sugar. So here is what the research found with Glucophage, that their baseline was at 241. So the average baseline in this sample size of 141 people, 141, yet millions of people are taking it. So the change at the final visit of their blood sugar was 53. So a change in 53. Their hemoglobin on average was a change from 8.4 with a change of 1.4, and that their body weight went from 201 to with 1.4 pounds lost after 6 months. So, you know how many doctors put someone, they suggest taking metformin to quote unquote lose weight. I had a patient who was who came in and they said, doctors want me, they said I'm pre-diabetic, they want me to go on metformin, and they said if you take metformin, you'll lose weight too. So that's another added benefit. Yet in this sample size, the average weight loss was 1.4 pounds over 6 months. Can you believe that? Can you believe that? So when you look at this change, is that the average change still puts them at having a fasting blood sugar of 190, okay? Their hemoglobin down to about 7, which is still diabetic, and their average weight loss of 1.4 pounds. Now, here's what's interesting. In the placebo group, they still saw that their change in their blood sugar still went up. They saw that their hemoglobin went up. But what's interesting is that the actual control group lost more weight. Interesting, right? So when you look at this, you see, okay, well, yes, it does in fact outperform, the control group, which was receiving a placebo. And guys, in order for a medication to be accepted, to be used, it only has to outperform a placebo, but it doesn't have to outperform it by a ton. As long as it outperforms a placebo, then they can use that as a medication. That's an improved medication. So I want you to think of this. 6 months taking a medication and their blood sugar, fasting blood sugar, is still at 190. So the whole idea behind this is saying after 6 months, hey, we gave you all of this medication, which on average costs $30 to $70 per month, depending on if you're doing a generic or if you're doing a brand name. But the end result is this. After 6 months, congratulations, you still have type 2 diabetes. You know where I'm going with this? Is that after 6 months, you're still a diabetic. So we tried working on your nutrition. We tried working on nutrition and taking metformin. But even after 6 months, congratulations, you still have type 2 diabetes. And you're still going to have the negative consequences that come along with type 2 diabetes. Which if you look at anyone with type 2 diabetes, guess what? They have a very low cardiovascular function because their red blood cells keep getting damaged. So they have a hard time with breathing or oxygenating their tissues. They're chronically inflamed, which is why they have so many joint issues going on. They have neuropathy. They have damage to their blood vessels. And the end result is that they have lost a limb. They die of an infection. They die of kidney failure because kidneys are soft tissues as well. And or they have a heart attack or stroke, infection. I mean, that's the end result. So really, what is it doing? Is it actually healing a person? Or is it just prolonging their inevitable death? It makes you wonder really what the purpose is of taking metformin. Is it really just manipulating, or is it actually restoring a person back to health? I'll leave you to come up with that answer. So then I went on to WebMD, and I looked at the medication. And there's a place where people can actually leave reviews for metformin. So thousands of reviews were left, and it didn't receive super favorable reviews from thousands of people. And in fact, I believe that the average rating was a 3 out of 5, and most of the positive ratings were basically just because, hey, this is awesome, it lowered my blood sugar, but I'm still a type 2 diabetic. So if you look at this one, this person left a rating of 2 out of 5 stars, and here's what they said. I have irritable bowel syndrome. This prescription caused me to have severe stomach pain and diarrhea. Okay, this person said, gave it 2 stars. They said this, 1-star review. If you have any prior gastrointestinal issues, do not take this medicine. In the days I took it, I had multiple issues with almost any GI issue you can imagine. Additionally, this medicine caused me to have low blood sugar. If I could give it 0 stars, I would. All right, so you'll see that there are so many negative reviews about this, and the reason why is that the number one side effect, the number one complaint, is what it does to the gastrointestinal system. Now, guys, most people, if you are a type 2 diabetic, you are going to already have massive gastrointestinal issues. The reason why I say that is in order for you to become type 2 diabetic, you would have already had to have eaten not only a lot of processed sugar, but I guarantee you, you've also had a lot of gluten to go with it. And remember, wheat gluten is extremely damaging to the gastrointestinal lining, which if you are a type 2 diabetic, I have never seen a type 2 diabetic who has tremendous, awesome gastrointestinal health, amazing solid bowel movements. They don't have some issue with yeast overgrowth, with an altered microbiome, with some increases in Methanobacter smithii, with some sulfur-producing bacteria as well. And so you start giving that, and yeah, their blood sugar is lower, but now they have more gastrointestinal issues. They're going to continue to become inflamed, and they're just basically robbing Peter in order to pay Paul and still stay diabetic. So this comes from PubMed, from the National Institute of Health, and this is what they said: metformin and the gastrointestinal tract. So here's what they said. Metformin is an effective agent with a good safety profile that is widely used as a first-line treatment for type 2 diabetes. Yet its mechanisms of action and variability in terms of efficacy and side effects remain poorly understood. Meaning, we don't actually know really why it works, and we don't know why there's any kind of side effects. Although the liver is recognized as a major site of metformin pharmacodynamics, recent evidence also implicates the gut as an important site of action. Metformin has a number of actions within the gut. It increases intestinal glucose uptake, lactate production, increases GLP-1 concentrations, the bile acid pool within the intestines, and alters, wait a second, and it alters the microbiome. So they actually admit that this alters the microbiome. Who says so? The researchers. They know that it alters the microbiome, yet they have no idea why. Okay? So here is what they say. Okay? They say a common finding was a reduction in butyrate producing bacteria and an increase in opportunistic pathogens. So they say that when you take metformin, you're going to have more issues with pathogenic bacteria overgrowing in your gastrointestinal system. Do you think that's going to make you more inflamed? Do you think it's going to cause changes in the gastrointestinal tract? Do you think it will make you more susceptible to having colon cancer? Do you think that it will make you more susceptible to a host of other things inside of your body? But here is what's interesting, is that they said something really interesting that probably not a lot of you even know, is about the role of butyrate, or short-chain fatty acids, in blood sugar control. Okay? It's the role of butyrate in blood sugar control. See, one of the things that you'll see and you'll notice with people with poor blood sugar control is that you actually need healthy bacteria to control the blood sugar. And so when you are a type 2 diabetic and you exacerbate it by taking metformin, is that it can exacerbate down the road your issues with type 2 diabetes and make it even harder for you to be able to overcome it. So here's what they say. Metformin alters the microbiome in mice and humans, causing an overall decrease in the bacteria diversity of the mouse microbiome. Okay? So guys, if you don't believe me, go ahead and do a Google Scholar on the role of butyrate and in blood sugar control. Because basically what butyrate is butyrate is a metabolic byproduct of the microbiome if you have healthy and diverse amounts in the right amount within the gastrointestinal microbiome, and it helps with blood sugar control. Okay, this is why having healthy fiber is so important. Things like chicory root, things like cooked and cooled potatoes, like potato starch. And I know that all of you are going to run out and go get some, but this is the food that is feeding the gut microbiome. Diabetics typically don't have enough fiber in their diet because where's the fiber found? The fiber is found in healthy food, and you have to eat a whole bunch of processed food and junk food in order for you to have this poor blood sugar control, insulin resistance, leading into type 2 diabetes. So what's the consensus? The consensus is this: you can take metformin, it's going to wreck your gut, and not only that, it's still going to leave you diabetic. This is why you have to start getting to the reason why it happened in the first place. Doctors don't have the answer for you. And the reason why is because the answer is already inside of you. If you want to start to increase and start to improve your insulin sensitivity, one of the first things that you can do is stop eating what is causing the insulin insensitivity, which is too many sugars that are easily crossing the gastrointestinal barrier that then spikes the blood sugar and causes your insulin receptors to start to down-regulate. So hopefully, guys, that makes sense. Now, next week, make sure that you guys listen to this, because what I'm going to go over is I'm going to go over some pretty cool research from PubMed that talks about an alternative that we put on people quite a bit that works similar to metformin without all of the harsh side effects. And the name of it is called Gymnema. So what's interesting is I'm going to show you research that shows how Gymnema actually can cause lowered blood sugar, can cause you to have a huge distaste and actually help with cravings for sugar, because it just doesn't, sugars and sweets don't taste good anymore. But even show you research how it actually will heal the arterial linings, how it actually helps to heal the brain, and how there actually is capability of regenerating the beta cells in the pancreas. And this is extremely important for people with type 2 diabetes who are now can't produce with pancreatic fatigue, and also in type 1 diabetics who have had their basically their beta cells destroyed by the immune system, because the immune system is trying to clean out some kind of viral infection that is going on. So, and I've seen it. We have tested people who were type 1 and type 2 diabetics, and we've even seen through testing, we've even seen the beta cells start to regenerate and start to perk up. And I'm going to go over one of the things that can help with that, and it's called Gymnema. So if you guys haven't seen this already, just like I promised, up at the top of this page, pinned to the top of this page, is our last event of the year. It's called Let's Talk About Stress. And guys, if you're a woman, you got to hear about this, because ladies, physiologically speaking, stress will destroy your hormones. Who says so? The physiology textbooks. So we're going to talk about mental stress. We're going to talk about the stress response mentally and how it affects the gastrointestinal system, how it affects serotonin production, how it affects your hormone system, how it will actually lead to what's known as a pregnenolone steal in order to make stress hormone, which will affect your fertility cycle. And we're going to talk about how you start to deal with it from a mental standpoint. This is a really good talk, guys. And I don't want to toot my horn, but I think this is a great talk, only because I created it in order to help me, okay? In order to help me. So I'll give you some awesome tips and lessons from my life, and I'll show you how I actually dealt with it. And hopefully, guys, it will help you. But we'll show you what you can do and how you can be testing for a stress response in order to know how to get that under control. So all you guys got to do is, if you are from the Yorkville or actually from the Chicagoland area, go ahead and go to the top of this page and register for this in-person event. I know that a lot of you are saying, can we get the webinar version of it? I will work on it, guys. All right, I will work on it. But again, last time that I did the immune system talk, everybody wanted it, and probably 300 people asked for it, and I think only 60 people were willing to invest into that talk. So guys, if I'm going to sit down and do a whole webinar, I got to know that there's a lot of people who are willing to be on that webinar event, okay? So if you guys are from that Chicagoland area, go ahead and go to the top of the page, register for it. Space is limited to the first 50 people that register. So the first 50 people that register, they will have a seat at the Let's Talk About Stress event. That is going to be December 4th from 10 o'clock until about 11:30 or 12, right around that time. It is going to be awesome because our health gets destroyed during the holidays, and I'm going to teach you how to handle it better from someone who has at one point been so unbelievably stressed. So guys, I hope you enjoyed this. Make sure that you share it. I always appreciate you sharing it. And next week we'll be talking about gymnema. The week after that we'll be talking about nutrition. And the week after that we'll talk about exercise and blood sugar control, why that is so important for so many people. So guys, I hope you have a great Monday. I hope you guys have an awesome Thanksgiving as well. I may, if I have some time, because I will be driving on Thanksgiving morning. If you guys want, I may go live in the car and do a short question and answer session. And if I do that, that might be around 9 o'clock in the morning in the car as I travel. All right. If you guys want that, just let me know. And we'll talk to you guys very soon. And if I don't see you, have a wonderful Thanksgiving. We have so much to be thankful for, and I want to let you guys know that I'm thankful for you. So guys, be well and have a blessed night.